Hello, everybody. We are going to do our first recorded lecture for Unit 2. So now that we are on Unit 2, we have a new word list. I'd like to point out that there is two separate word lists for Unit 2. There's an integumentary system word list, and there is a musculoskeletal word list. So the integumentary word list is under week three's materials, and the musculoskeletal word list is under week four's materials. So make sure that you are studying both word lists. All right, there's a link to a little pre-quiz here. If you want to test yourself and see what you know so far, I think it's only about 5 questions. So take that first and see what you already know. And at the very least, make sure you take that at the end of this lecture because you should be able to get a few more of them right, or at least all of them right by the time we do our next couple lectures as well. So we're going to focus on the integumentary system today. So these are the four main functions of the integumentary system. Protection, that can be from physical harm such as a cut or abrasion, but also protection from UV light. Regulation, that goes for temperature as well as hydration. We have a lot of our nerves in our integumentary system, or in the skin aspect of our integumentary system. So sensation's a big function. And then secretion is another major function. And we'll talk about a couple different types today as we go through our different parts. Okay, so we're going to go through the parts of the skin. The integumentary system as a whole includes our skin as well as our hair, our nails, and all of our other accessory structures like our sweat glands and our oil glands and a couple other things that we'll talk about. So hair, skin, and nails is really the integumentary system. And so you'll see for the rest of our class, we will kind of go through system by system to introduce you to new words. That way we can continue to show you how they are applicable in terms of the anatomy and physiology side of things. So this is just a quick rundown of the different parts of the skin. You see we have two major layers that are considered the skin. We have our epidermis. This is that darker pink through here in this top portion of the skin. And then we have our dermis, which is a much thicker layer. You'll see we have our vein and artery, our blood supply is in the dermis. We have our sweat glands down in the dermis. Our hair follicle, where our hair grows, is down in the dermis. And then if we go below the dermis, which is called the hypodermis, below the dermis, we get to our adipose tissue, which is our fat. The hypodermis is also known as the subcutaneous layer because the epidermis and dermis combined are our cutaneous membrane. So remember, cutaneo is one of our word roots for the skin, and derm is another word root for skin or the dermis. Okay, so as I just said, our epidermis is this upper layer, this outer layer. So this is the layer we can actually feel. It has multiple layers, but the outer layer gets all the way to our external surface. So it protects the body and it synthesizes vitamin D. So it has a molecule that's produced when sunlight hits the skin that is essential for processing vitamin D, which we need for strong bones. So you'll see here that we have these nice cells all through this darker pink layer here. The purple nucleus or the cell's control center is highlighted. But as we get towards the top, all you kind of see is white and it flattens out. As our cells in the epidermis go from the bottom layer to the top layer, they go through a process known as keratinization or hardening. And that's how it forms that protective layer and the seal for our body. So you'll see we have actually 5 different layers to our epidermis most of the time. Stratum lucidum is only in thick skin, so every once in a while this will be dropped out. Our stratum corneum is the hardened portion. So this is the outermost layer that's exposed to our environment. The stratum basale, or our basal layer, this is where our new cells are. So this is the layer that actually goes through cell division to create new skin cells. And as new skin cells are made in this bottom layer, older cells are pushed up towards the top. And as I said, they go through a process called keratinization. So you'll see as we get up towards the top of the stratum spinosum, our skin cells are now keratinocytes. So they've gone through that keratinization process. And in our stratum lucidum and mostly in our stratum corneum, they're actually dead cells. So they're fully hardened and dead. A couple other things to highlight here. You see a dendritic cell. This is a cell within our nervous system. You see a tactile cell, or sorry, our dendritic cell is within our immune system. So this is like a white blood cell. This is part of our defense system. Our tactile cell, this is one example of one of the nervous system cells or specializing nervous system cells in our skin. So we have tactile cells that are specific to different sensations such as vibration or pressure or temperature. The melanocyte down here, this is where melanin is produced, which is the pigment that gives skin color and hair as well. So all of us have about the same number of melanocytes, but we have different rates of melanin production. So everyone has about the same number of melanocytes, but people with darker skin, they're more active and produce more melanin. So that's down here. So when we get into this lighter pink where we don't see our cell nuclei anymore, sorry for the slides there, we get these little hills in the dermis where it meets the epidermis. Those are called dermal papilla. The little hills are called papilla. And so they're highly vascularized, meaning they have a lot of blood flow, and sometimes they have a nerve supply, but especially blood flow. So these are areas that get a lot of nutrients. They can pass those nutrients up into our epidermis that does not have a blood flow directly. And so this is the area also where our hair follicle and our hair bulb is going to implant because it can get all the nutrients it needs to grow all the way up to the outer layer. One other thing that I want to point out is you see with this sweat pore, even though it starts down in the dermis, it goes all the way up and releases the sweat into the surface. Okay, moving on to the dermis. Remember, this is our thicker layer underneath the epidermis. So you see again, here's our dermal papilla, or the papillary layer where those little hills or extensions are of the dermis. And so because our dermis is thick, it plays a role in thermoregulation and has our blood vessels. So our blood vessels can dilate or get wider. That brings more more blood to the surface of our skin. And that helps us dissipate heat, or vice versa. The arteries in the dermis can constrict and keep blood in towards the core so that less heat is lost. So that can help in thermoregulation. And we already pointed out the tactile cell, that's one of our specialized nerve cells for sensation. I said this earlier, but just to point out again, it has our nerve endings, blood vessels, oil glands, which are also known as sebaceous glands. We'll point those out in one of our other slides. And then the sweat glands that we have seen before. Okay, going all the way down. So remember I said the epidermis plus the dermis is what makes up our skin, or the cutaneous membrane. Now we're talking about the hypodermis, which means below the skin. It's our subcutaneous layer. And so it's going to connect our dermis to the muscles and bones underneath. It's kind of our anchor to everything else underneath, our main structure. So this is going to mostly be adipose tissue, which is fat tissue. This is also highly vascular, meaning there's a lot of blood supply, because all of our arteries and veins that are getting to our dermis have to pass through the hypodermis to get there. So we still have a lot of blood supply. Okay. The hair, the nails, our sweat glands, and our sebaceous glands, which are our oil glands, are all considered accessory organs. So our hair has a few different sections to it. The part that's above the surface is the hair shaft. The hair follicle is this covering or divot that the hair itself can sit in within the dermis. If I were to peel open this follicle, you'll see at the bottom here of the hair is called the hair bulb. And so it's getting its nutrients from the blood supply underneath it. This little muscle here is called an erector pili muscle, and it makes our hair stand up on end. So when you get the goosebumps, it's your erector pili muscles that are contracting to make that happen. I already showed you our sweat glands, so remember those go right up to the surface from the dermis. And then we have these sebaceous glands, which secrete a substance called sebum, which forms an oil. It lubricates our hair a bit, and it also lubricates our skin. And so it actually releases the sebum directly into this hair follicle and onto the hair. So our sweat goes directly to the surface. Our sebum or the oil goes onto the hair itself to get to the skin. Okay, let's do a little bit of practice. So the parts that I underlined should not be brand new words to you. The parts that are not underlined may be new words from our list. So go ahead and pause your lecture here and take your time going through and trying to define these using your new list. Okay. If you're restarting the video, hopefully you've gotten all of your definitions written down, and now it's time to check your work. Okay, melanocyte. So melano is our combining form for melanin. So a melanocyte is going to be a melanin-producing cell, a cell that produces melanin. Dactylogram, a gram means a recording or an image. So dactyl is our word root for finger or digit. And so a dactylogram is going to be a fingerprint, an image of a finger, a fingerprint. Keratosis. So osis is an abnormal condition. Kerat is for keratin, so an abnormal condition of keratin. So it's when cells keratinize or over keratinize where they shouldn't be. Onycholysis. So lysis is an old one. That means to dissolve or disintegrate. And then onych is our root for nail. So disintegration of the nails, like this picture here. Ichtyoplasia plasia is an old one that was on our first list. That's growth. Ichty is dry or scaly. So this is dry or scaly growth. So this dry skin or growth of dry skin is ichtyoplasia. Plegia, you should have recognized from your last list. That means paralysis. And so this one I actually don't think is on your list for integumentary system, but it is on your musculoskeletal list. It's olecranon, so that's our combining form for olecranon, which is your elbow. So olecranoplegia is going to be paralysis of the elbow. A I'm sorry, guys, I'm getting tongue tied up. A dermatosarcoma is going to be our original word, or what we've already seen is dermat. That's our skin. Sarcoma is a cancer of connective tissue. So a dermatosarcoma is going to be a cancer of the connective tissue of the skin. Fascioid. Oid is the suffix for resembling. Fasci is for fascia, which is kind of another word for tissue. So fascioid would be resembling fascia or resembling tissue, but it wouldn't really be natural tissue or something that's supposed to be there. Oid usually means that something is off. And our last one is hyperhidrosis. So all of these parts you might know. Osis is an abnormal condition. Hyper is excessive or too much, and hydro is water. So hyperhidrosis is the abnormal condition of sweating too much. Okay, we're going to go through a little bit of this together because not quite all of these are right directly from the list. So take a second, pause the video again. I'll give you a couple hints here. Metastatic cancer of this cell type, we're talking about the melanocyte. You should be able to come up with that one with your word parts. The cancerous tumor occurring in the stratum basale, you should try to find that one down in your abbreviation section of your integumentary vocab list. And then for this top question, I want you to ignore this part where it says in patches and go ahead and let's say when this causes dyspigmentation due to lack of melanocytes. So what skin disorder would that be? So go ahead and pause it now and then start it back up after you get your 3 words down. Okay, let's go over this. We'll go from left to right here. So cancerous tumor occurring in the stratum basale would be BCC, a basal cell carcinoma. So dyspigmentation in patches, that is actually known as vitiligo. Many people know Michael Jackson as a very famous example of a person who suffered from vitiligo. If you have complete lack of melanin, this one is on your list, you would have albinism. And then last one, a metastatic cancer of a melanocyte is going to be a melanoma, a malignant melanoma. Malignant means cancerous. Benign means safe or non-cancerous. So the suffix OMA, oma, is for a tumor, so it'd be a melanoma. All right, just some more practice. Go ahead and pause the video and try to answer these questions. For this bottom one, go ahead and give me the word for an inflammatory condition of the sebaceous gland, and then I'll tell you what it causes. All right, let's go ahead and go over this. So there could be a couple right answers for this top one. There's not one that directly translates or a disease or condition that's on your list that directly translates. You could say this is a melanosis or a lack of melanin. You could say pilar amelanosis or amelanosis that's relating to the hair. A chronic inflammatory condition of the epidermis is going to be dermatitis. Then an inflammatory condition of a sebaceous gland is going to be called sebitis. SEB is our word root, sebitis, and that is what causes acne. All right, let's do a little bit more practicing. I gave you parts of the words here, so go ahead and see if you can fill in the remainder of the blanks. Okay, so infection of skin / tissue. So you could say dermatitis, you could say cutaneous or cutaneous. You could say fasciitis. There's a few answers that would work for that top blank. Pertaining to lasting a long time. So our IC suffix is pertaining to, and this one is going to be chronic. Pertaining to preventing an itch. Again, our IC is pertaining to, and our answer is going to be antipruritic. So that's a PR, antipruritic. So you might have to look at your word list to be able to better spell that out. Condition of without movement is going to be akinesis. akinesis. The scar, I'm going to show you that one because it is not an easy spelling one. So I'll show you that one in just a second. A condition of dryness, or we said dry and scaly is ichthy. So you could say a condition of dryness is ichthyosis if you wanted to use our word root. Or from our list at the bottom where you have some of your skin conditions, it's psoriasis. So let me go ahead and show you the scar one real quick. So cicatrix. Cicatrix. So it's not with an S, it's with a C. Cicatrix is that scar, just so you guys can see it. Okay, let's practice one more time. So go ahead and see if you can write your midterm that matches these definitions. So pause the video as you need to, give yourself time. Okay, make sure you have all your answers written down, take your best guess. So a condition of nail fungus. So our nail one is onych, O-N-Y-C-H, or it could be ungu, U-N-G-U. Onych or ungu are your two roots for nail. So a condition of could be cis, S-I-S, or osis, either one. So onychomycosis or ungumycosis would be your condition of nail fungus. A fatty tumor, you'll see fat has a few different word roots, but the most common thing you would see in real life application of a fatty tumor would be a lipoma. You could technically on a test say adipoma, but you would hear lipoma most often. Process of viewing the dead. So process of viewing, our suffix there is scopy, S-C-O-P-Y. And for dead, our word root is necro, N-E-C-R. Necropsy is the process of viewing the dead. Disease of the elbow. So disease of is going to be our suffix pathy, P-A-T-H-Y. And we said earlier that olecranon or olecrano is our combining form for elbow. So an olecranopathy is a disease of the elbow. A surgical incision of the fascia, that's going to be a fasciotomy. And then surgical repair of one wrinkle. This is a bit of a longer one. So surgical repair, that's going to be our suffix of plasty. Remember, we always start with the suffix when we look at our definitions. So surgical repair, we know it's going to end in plasty. Now we need one wrinkle. So to have one, we're going to use our prefix uni, U-N-I, and then our word root for wrinkle is rhytid, R-H-Y-T-I-D, unirhytidoplasty. 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 Okay. You guys at home don't necessarily have friends sitting next to you, so you can skip this part. And then the last thing. So overall, everyone did pretty good on the exam. You can see that it's definitely very heavy on the vocab list. So that's where you should certainly focus your studying in terms of memorizing your words. You'll also see that our words farther down the list that aren't necessarily one of our word parts, not necessarily just the prefixes, word roots, and suffixes, but also the additional words like we have down here, these additional med terms, those you need to study as well because you'll see those pop up. If you really put in the effort on your homeworks and quizzes, that'll help you very much. You can see, again, those look very similar to the questions that you see on your exam. Now you know what to expect, so hopefully everyone will continue to improve. Remember, we do have our optional final exam at the end of this semester, so if you're unhappy with how you do on one of the exams, don't let it stress you out. You can always just study and prepare well for the final, and that'll replace your lowest exam grade. So keep working hard and keep studying.